Part 1.
Today I will do physical examination for Mr. Hanan, and I prepare my equipment. The equipment is BP limit, SpO2, scale pen, stethoscope, pen torch, thermometer, peak flow, and patient VHG, and also checklist of asthma control. And sanitizer. I screen the patient. Okay, good morning, Mr. Han. I am OM student. Today I will do my physical examination and also check your breathing assessment. Okay, may I know what's your name?
My name is Mr. Hanan.
Hanan, can you tell me your IC number?
801217.
Okay, I will check for you BP. Okay, come. Okay. Temperature 36.6. Okay, the reading is normal, Mr. Hanan, 123 or 82. Okay, pulse rate 81. Okay, and SpO2 100. Okay. Mr. Hanan oxygen level is 95% with nasal prone 3 liter per minute. Okay, here is your pain scale. Okay, I will explain to you, Mr. Hanan, your pain. Okay, 0 is no pain, 1 to 4 is moderate, mild pain. 5 to 7 moderate pain, and 8 to 10 is acute pain. Do you feel pain any part? You feel anything? Pain? No pain. Okay. Thank you, Mr. Hanan. Mr. Hanan, where are you now? Hospital. What is time now?
4 p.m.
Do you know what I'm doing now? Physical examination.
Physical examination.
Okay, thank you. Mr. Hanan, I'm doing physical examination for you. Okay, I start from the head. Okay, there is no hematoma, no alopecia. Okay, the eye is symmetry. Okay, subconjunctival pink. The ear is no discharge. Okay, can I see your account? Okay, no hydration stain. Okay, put back. Thank you. Okay, Mr. Hanan, can you sit for me? I want to check your neck. Okay. Can you put up? Okay. There's no lymph node. C. Okay. No enlargement. Thyroid. Okay, thyroid gland. Okay, can you stretch out your hand? They are okay. Okay, no tremor seen. Okay, I want to check your toe. Can you winkle your toe? Winkle. Okay. Okay, no edema. Okay, no vena varicose. Same. Okay, this is Hanan. Okay, I check the eye. Okay. Pupil reactive with the light 3 mm. Okay, the chest is moving equal, and then he's not use any necessary muscle, and then breathing is normal. No tachypnea, no bradycardia. Equal vibration on both sides. Equal bilateral chest expansions and symmetry of both lungs. Breathe in, breathe out, Mr. Hanan. Okay. Breathe in, breathe out. Breathe in, breathe out. And now I check for the apex fix in 1 minute. The sound is normal. Healthy lungs filled with air. There is no sound of wheezing, crackles, ronchi. Okay, Mr. Hanan. Okay, Mr. Hanan, I want to ask some question. Can you answer me? Okay. Do you have a cough?
No.
No cough. Mr. Hanan, inhale and blow. Okay, good. Okay. Okay. One more. Okay. Thank you. Mr. Hanan, I want to check your quick coming abdomen. Okay? Can I check for you? Okay. Okay. The abdomen was soft, no tenderness. Feel. Okay, no mass. Feel. Okay, now I want to listen to the bowel sound. Okay, I heard the bowel sound. Now I check your skin. Okay, the temperature is a normal range, and then the skin was moisturized, no dry skin, and no rashes, no redness. Okay, Mr. Hanan, how's your appetite? Appetite, your food, you can take all the foods. Okay, good. And then how's your? Do you feel any nausea and vomiting?
No.
No. How's your urine?
It's a normal.
Normal urine. And your bowel open is harder or smooth stool?
Smooth stool.
Smooth stool. Okay. Thank you, Mr. Hanan, for your cooperation. Now, Mr. Hanan, I want to check you. Can you help me to stand? Okay, can you walk for me? Are you feel okay, comfortable?
Okay.
Do you feel any breath, short breathness?
No, no, no.
No. Okay, come lie down. Okay, the finding which I do the physical examination is a normal finding, and if any abnormal, I will note it in the record book and I will inform to the doctor. Thank you, Mr. Hanan, for your cooperation. Thank you so much, and accountable the patients. Okay.
Part
Why
2.
is a thorough respiratory assessment important to Mr. Hanan case? Okay, a thorough respiratory assessment is really important because Mr. Hanan has a long-standing history of asthma, and lately it feels like things are not stable anymore. He got increasing shortness of breath and wheezing during sleep. Pulse, he's recently bad an upper respiratory tract infection. Although signs sort of hint of the breathing problem may be may be worsening more than before when I do the complete respiratory assessment. I can look at his breathing pattern, count the respiratory rate, check oxygen saturation, watch for the chest movement and listen to the lung sound. I can also spot my usual result like wheezing and possible less are coming in depending on what I hear and what I see. This kind of evaluation show me how serious the situation, help me to track how well he responds to the oxygen therapy and allow earlier identification of complication. It also steer the nursing care that match him the best and general is give the whole healthcare learn a better base to pick the most applicable treatment for Mr. Hanan. The second, what is the signification of performing a cough assessment for Mr. Hanan? A cough assessment is kind of important because coughing is one of these main clue for the respiratory illness. So yeah, it's matter early too. When I do the assessment, I ask about when the cough started. It is dry or productive or often it comes and whether there is any sputum. If sputum show up, I look at the color, the quantity, how thick it seems and also there is any blood, even small amount. All these a bit help me figure out what might be going on like airway irritation, mucus and acclimatation, a possible infection or even that asthma is getting worse. A cough assessment also helps me see whether Mr. Hanan can clear his airway effectively. If he can't clearly the mucus properly, it makes a breathing difficult more likely or lead to the lung infection. So the kind of assessment is useful for planning nursing intervention and for tracking its progress over time. Number 3. Describe the specific finding during the focused respiratory assessment. During my focused respiratory assessment, I noticed that Mr. Hanan looked a bit short of breath, not terrible, but still notable. His respiratory rate seems slightly up. He was getting oxygen at 3 liters per minute throughout a nasal canal and his oxygen saturation reached 95%. When I inspect him, I saw chest expansions that symmetrical plus a mild use of accessory muscle while breathing. There was no nasal flaring, which was kind of reasoning. Our palpitation, the chest rise feel even on both sides and tachypneitis was also equal. When I pursued the lungs feel they are sound resound, so no major dullness. And occultation, I pick up the bilateral breath sound with the expiratory wheezing. The sort of the wheezing can be seen in asthma patient. Yes, the air entry feels slightly reduced at the lungs base, not dramatically but present. Mr. Anand also mentioned that the short breaths get worse when he lies flat and he said he needs extra pillows to sleep without feeling uncomfortable. Overall, this sign pointed for the respiratory condition that really need close watching plus ongoing treatment as planned. Number 4. Why should Mr. Hanan activity tolerance be evaluated? The activity tolerance should be checked before the breathing problem can lessen the amount of oxygen but actually reaches the body tissue and the things get hardened by the patient. When the oxygen level are reduced, the person may feel tired, weak, so short breath and even during the normal day-to-day tasks like walking, climbing the stairs, bathing or getting distressed. By checking activity tolerance, I can figure out how much Mr. Hanan can do safely without getting breathless. The kind of the partial also let me judge how serious his condition is, keep track on his progress after treatment, arrange nursing care at the fit, that teach emergency convocation as well as safety activity routines. In the end, of assessing activity tolerance support Mr. Hanan's safely, independence and overall quality of life. Thank you.